Hello, this is Eric Neal, your exercise physiologist and nutritionist. I'm bringing to you today Jason Ham's sleep optimization course titled Sleep, the Only Fix, All for Health and Human Performance. The learning objectives are causes of fatigue and sleep deprivation, consequences of sleep deprivation and fatigue, describe ways sleep is related to performance, exercise, caffeine, alcohol, nicotine use, nutritional choices, and energy levels. And we're going to list sleep improvement strategies. What percentage of people can get by on less than 5 hours of sleep per night? That's right, 0. 2 weeks of 6 hours a night sleep equals a 0.1% blood alcohol content equivalent. Some causes of sleep deprivation: stresses of daily life, work, relationship, financial issues. All that type of stress will definitely make it harder to get to sleep, especially if it's bothering you later at night. We fail to prioritize sleep. That's often, our sleep is often something that we'll sacrifice because we want to get more done in the day, and we definitely should not do that. Something that Arnold Schwarzenegger tells people to do, and I hope he was joking when he says it, was a motivational video, and he tells people to sleep faster. He's recommending to sleep 6 hours a night instead of 8, and that was some bad advice. Sleep definitely needs to be a priority, and that should not be something that we sacrifice when we need to make any type of sacrifice in our time. You know, we can do something different to sacrifice. Maybe tape a TV show and watch it on the weekend. That's just one example of a way that we can prioritize sleep into our schedule. Medical or mental health conditions can disrupt sleep, and then our nutritional choices, whether that be consuming caffeine or some type of inflammatory food or supplements. So a good nutritional choice to make within a couple hours of going to bed would be pumpkin seeds with Greek yogurt and blueberries. It's a tasty evening snack. It's also called a breakfast bowl too. But the Greek yogurt will make you feel a little bit sleepy, and the tryptophan that is in the pumpkin seeds has quite a bit of effect on making you feel sleepier at night. It boosts your melatonin production. For sleep and performance, as you can see here on this graph, we've got 8 hours of sleep, so 100% for performance. And then we've also shown 6.5 and 5 hours, 3 hours, and no sleep. The decrement measured in percent for normal cognitive performance. So as you see here, with 3 hours of sleep per day, after a week of that, you're performing at less than 60% of what you would if you were getting 8 hours of sleep. So that's very important that we don't sacrifice our sleep so that we perform better cognitively. Our stages of sleep. So what is rapid eye movement? That's the stage of sleep categorized by more dreaming, bodily movement, higher heart rate, and breathing. So during the rapid eye movement sleep, your brain is almost as active as it is when you are awake. And this is the time in our sleep that our brain is repairing also. During the non-rapid eye movement sleep would be when your body is being repaired. Take a look at this sleep architecture graph. As you can see, we've got a time clock here going from midnight to about 7 o'clock in the morning. And You're going to have about 3 to 5 sleep cycles each night that you sleep, and they range from about 90 to 120 minutes. Notice here in the beginning, your stage 4 sleep is a lot longer than it is later on in the night. And you don't get as much rapid eye movement sleep in the beginning either. So this is why it's so important that you get uninterrupted sleep. If you can get you a good 8 hours of sleep without any interruption, you're going to get a lot more rapid eye movement. As you can see over to the right side of this graph, there's probably 10 times more rapid eye movement sleep going on. And stage 4 sleep looks to be skipped after 3 cycles. So this is why you would want to try to sleep all night long and not break your sleep into like 4 hours in the night and 4 hours in the day. Try to get as much sleep as you can in the night. Diagnosis of chronic insomnia, so difficulties in initiating and or maintaining sleep associated with daytime consequences and not attributable to environmental circumstances or inadequate opportunity to sleep. The sleep onset latency and or wake after sleep onset is greater than 30 minutes. Sleep efficiency is lower than 85%. Sleep difficulties are present 3 or more nights per week. Increased use of alcohol to facilitate sleep onset would be an unhealthy behavior while deployed or at any time. 44.8% consume at least 1 energy drink per day. 14% 3+. Approximately 1/3 will increase their caffeine and energy drinks after deployment. 63% report 6 or fewer hours of sleep per night during deployed, and poor sleep hygiene choices. Now I'm going to bring to you the effect of alcohol on sleep. So a small quantity of alcohol often promotes the onset of sleep, but sleep becomes disturbed and fragmented as the alcohol is metabolized. Overall, a person will sleep less under the influence of alcohol. Alcohol is not a good sleep aid. Alcohol can indirectly impair daytime alertness and performance through its disruptive effects on sleep. A couple other things too to mention about alcohol is you're not going to get as much rapid eye movement sleep when you've consumed alcohol. There's a good chance that you're not going to sleep quite as long because it can actually have a stimulant effect after it wears off. And alcohol increases estrogen production and decreases testosterone production. Some signs of inadequate sleep would be struggling to stay awake during briefings or classes, difficulty understanding or tracking information, lapses in attention, decreased initiative or motivation, irritability. So ask yourself, how much sleep have I had over the last 24 hours? So if that number is 0 to 7, there's no clinically significant insomnia. 8 to 14 would be a subthreshold insomnia. 15 to 20 would be a clinical insomnia, and greater than 21 would be a clinical insomnia. So if you scored 12 plus points, it's strongly recommended that you schedule an appointment with your medical provider or director of psychological health. So now I'm going to go ahead and show you that Epstein sleep. How likely are you to nod off or fall asleep in the following situations? In contrast to feeling just tired, this refers to your usual way of life in recent times. Even if you haven't done some of these things recently, try to work out how they would have affected you. It is important that you answer each question as best you can. Use the following scale to choose the most appropriate number for each situation. Okay, so I went with, just like it says here, the usual way of life in recent times. So I gave it a 0 for sitting and reading. I don't typically fall asleep if I'm sitting. I need to be lying down. Watching TV, a lot of times I'm laying down watching TV. So I gave this a 1 because I do fall asleep sometimes when I'm watching TV. Sitting inactive, I give a 0. As a passenger in a car, I might put the seat back, just go to sleep. There's a slight chance. Lying down to rest when circumstances permit, definitely put an X there. If I'm talking to somebody, I'm not going to fall asleep. After a meal, without alcohol, not much of a chance I'm going to fall asleep, especially if I'm sitting. Or in a car while stopped for a few minutes in traffic. Definitely would not fall asleep in that situation. So my score was a 3. So fortunately for me, I don't have a problem with sleep deprivation there. Here it says that a score of greater than 10 or greater raises concern of needing more sleep. Performance and poor sleep. So sleep can be linked to airman fitness and readiness, health, mental and physical resilience, PT scores, BMI, and chronic diseases. So there's a decreased speed, strength, endurance, balance, vision, and agility, decreased testosterone production, and inadequate sleep of 4 hours increases pain threshold by 13%. Poor sleep impairs hormones which regulate appetite and metabolism and cause a 4 to 5% increase in weight, equaling 14.3 pounds per year. So those hormones that's being impaired are leptin and ghrelin. Leptin is the hormone that makes you feel full. Ghrelin is the hormone that makes you hungry. So we don't want those hormones being affected in a negative way. It causes food cravings, generally sugary processed foods. And I find that sugary processed foods, if I consume them, will make me even hungrier and want more. So we don't want to be having cravings for those. 85% increase in poor snack choice the day after a poor night's sleep. Consume about 400 more calories. You have an increased inflammation, increased risk for diabetes, obesity, stroke, and cancer. 72 hours of sleep deprivation, the effects one complex of mental operations. So for every 24 hours, you're seeing a 25% decrease in performance. So that's why it's so important to get enough sleep. Injury rates. So the likelihood of an injury, if you, over a 21-month period of time, if you only get 6 hours of sleep per night, it's slightly more than 70%. While at 9 hours of sleep per night, you're looking at about 17-18%. So that's even more reason why we need to get more sleep per night. We don't want to have an injury. Some fatigue-related accidents. There was a tired night crew They misdiagnosed a cooling system failure in the number 2 reactor at 4 a.m. Near meltdown occurs. Radioactive gas vented into atmosphere 2 days later. That was at 3 Mile Island. And now at Exxon Valdez, a third mate misses a light buoy marking shoreline, crashes into reef after hours of duty without sleep. 11 million barrels of oil spilled into Prince William Sound. And then the Challenger. NASA makes launch decision in the cold despite conference with Morton vehicle. Decision makers were sleep deprived. The space shuttle destroyed. All 7 crew lost. NASA suffers huge fallout. Cognitive performance and poor sleep. So you'll have a decreased alertness. Reducing sleep by 90 minutes for just one night could reduce alertness by as much as 32%. Accuracy and timing degrade. Lower performance standards become acceptable. Ability to integrate information is lost. Tasks become more difficult to perform. Your attention wanes. You increase risk-taking and reduces your emotional intelligence. Your mental health and poor sleep. So sleep deficiency can lead to mental health problems, increased risk for depression, anxiety, and substance abuse. There's an increased risk for suicide and all-cause mortality. If you get less than 6 hours of sleep per night, that has been associated with new onset post-deployment PTSD. The attitude and the mood deteriorate. Social interactions decline. Impaired sense of humor. Ability to logically reason is impaired. And it also increases a negative mindset. So if you're seeing someone around and they're very grumpy, good chances are they probably aren't getting enough sleep. So how can you get better sleep? What can we do to optimize that sleep? So for one, you want to try to keep your wake time the same every day, even on off days. That's hard to do. It's way easier said than done. I'm guilty of not sleeping the same time during the weekends, but I try my best to. I know that whenever I retire, that's going to be a huge priority for me because I'm going to be going to bed later and getting up later after I retire, and that will definitely make that goal easier to achieve. It's a little bit difficult to do this if you're getting up at 3 or 4 o'clock in the morning to do that same thing on the weekend. But we definitely need to strive to try to sleep at the same times. And the reason why is because of our circadian rhythms. We don't want our circadian rhythms being off. You don't want to lie awake in bed for more than 20 minutes. So if this is happening, what you probably want to do is just go ahead and get up and do something like read a book or do something relaxing, listen to some music or something like that. Because if you're just not getting to sleep while you're in bed, maybe you're thinking too much or something's stressing you out. And so find something different to do and then try to go to sleep again later. You want to avoid caffeine 6 hours before bedtime and nicotine and alcohol a couple hours before bedtime. Avoid any artificial light, TV, computer, tablet, smartphone screen before bedtime. And this is a good thing to do in the morning to consume artificial light, like 5K light. It's going to help you build up more melatonin so that you're going to be able to get to sleep easier at nighttime. But once we get closer to the bedtime, we don't want to be taking in this artificial light because it's going to keep you up. So that's a good thing for the morning, but not in the evening. You want to avoid any heavy meals within a couple hours of bedtime. Definitely, avoid anything that's inflammatory. I said earlier, the blueberry pumpkin seed Greek yogurt breakfast bowl is actually a good bedtime snack because it will help produce some more melatonin because it contains so much tryptophan. You want to make sure that you keep your bedroom environment cool and dark. So some things that you can also do in the bedroom is you can put up curtains that are going to block light from coming in. Avoid any blue light from like TVs or any other type of devices because those will inhibit melatonin at nighttime. You'll want to you can wear like a eye mask, cover up your eyes so that no light is getting in. Listen to music or play or have your like a fan or something like that for white noise. Those are all good ways to try to make the correct environment in your home. And the best temperature to have your home set at would be at 65 degrees for your sleep. So how much sleep do you need? Do the following to understand how much sleep do you really need. Sleep until you feel rested and restored. Repeat this until you can wake up without an alarm. Once you know how many hours you need, begin to establish a sleep routine with the same sleep and wake times. Ensure you practice good sleep habits. So this isn't going to be the same for everybody. Someone might be able to get by just fine with 7 to 8 hours of sleep per night, while another person might need even more. If you're lifting weights hardcore and doing lots of cardio and your body's needing more repair, there's a good chance that you might want to sleep 9-10 hours per night. I watched a video produced by ACSM for continuing education credit units, and they were talking about how many hours of sleep many athletes get. And so two of the athletes that I remember by name were Tiger Woods and LeBron James. So Tiger Woods was known for not getting enough sleep. I don't remember exactly how much it was that he typically got, but I do remember the amount for LeBron James. LeBron James sleeps 12 hours per night, according to this video. And it's good that he has the luxury of being able to do that because most basketball players do not have that luxury. They are put in a position where they have to do a lot of travel, and it's known that many of the players in the NBA suffer from sleep deprivation. So good for LeBron for being able to fit that in his schedule to where he can get those 12 hours that he wants per night. Drowsy driving. Warning signs of drowsy driving: yawning or blinking frequently, trouble keeping eyes open and head up, difficulty remembering the past few miles driven, missing your exit, drifting from your lane, hitting a rumble strip. If you feel drowsy, pull off the road in a safe rest area or parking lot and take a 15 to 30 minute nap. Rolling down the window, turning up the radio or air conditioner, or drinking a caffeinated beverage is not enough. So drowsy driving makes up 25% of the accidents on the road, okay? And I know firsthand because I'm lucky to be alive, because I did not take some advice given to me when I was very young. When I first got into the Air Force, my first duty station, after working a full day, I got in my car and drove from Columbus, Mississippi to Point Pleasant, West Virginia, which was about a 700-mile drive. And I was within an hour of getting home, and I fell asleep at the wheel, hit a guardrail about 68 miles per hour. I'm very lucky that the angle that I hit the guardrail didn't cause me to have a scratch. It had a nice little tear up on my car, but I was able to wake up immediately. When I hit that guardrail, I got my car under control and drove it back home. But if I would have hit that guardrail at a different angle, it possibly could have killed me. So I learned at a very young age, at 18 years old, that if you're feeling sleepy at the wheel, then you might need to just pull over and take a nap, do whatever you have to do. Don't continue driving and have an accident causing harm on not just yourself, but the others around you. Circadian rhythm and sleep pressure. So during the night, we have a sleep urge, followed by, in the evening, going into the night, we develop a sleep need. So things like artificial light throughout the day are going to build up a sleep need, and the longer that we are awake is also going to build up a sleep need. And our hormones will also affect this too. The hormone cortisol is what wakes you up in the morning time. So that's like its highest levels, like 8 o'clock in the morning. And your melatonin levels become very low during this time period. And as the evening comes along, the melatonin levels start to increase a good bit. And then they peak at levels after like midnight. And the cortisol levels they remain low until it's about time for wake up. And the cortisol levels, they maintain kind of a level amount after a nice initial dip. After 8 o'clock in the morning, when it's going to be the highest, it's going to eventually kind of just work its way down, and then it just kind of levels off. So when those cortisol levels are low and the melatonin levels are high is when it's going to be easiest for you to get to sleep and get better sleep. So a recommendation that I would make if you are a shift worker, let's say that you are working the midnight shift, rather than going to bed as soon as you get off work in the morning time when a natural circadian rhythm is going to have you at a high cortisol level and a low melatonin level, you're not going to sleep well during those times. And it's also very light out too. Okay? So my recommendation would be, even though it's not going to be as good as at nighttime, is to sleep in the evening. So maybe you go to bed around noon or 1 o'clock and sleep until it's almost time to go to work. And you'll be sleeping when cortisol levels are lower and as melatonin levels are rising. So that should be much better sleep. And if you are an evening shift worker, I would recommend that you go to bed immediately after work rather than staying up for a long time. That way you're sleeping when it is dark out and when your melatonin levels are at their highest levels, rather than sleeping into like a later part of the day. Like maybe if you're able to go to sleep at around 11 o'clock at night and get up at 7, rather than go to sleep at 3 and get up at 10, because of the hormones, cortisol and melatonin, where those levels are. So some additional stuff for shift work sleep tips. You want to allow more time in bed. So if you're looking to get 7 to 8 hours of sleep, you might want to go to bed for 9 to 10 hours of sleep in case you're having a hard time getting to sleep. Wear dark glasses to block out the sunlight on your way home. Keep the same bedtime and wake time schedule even on the weekends. Easier said than done, but that would be helpful. I also think that can play part in immunity too. I remember I used to, I worked at midnight at Walmart, and I ran my personal training business in the morning time, and I would sleep in the evenings. And on my 2 days off that I had from Walmart, I would always get sick at some point. Like not really sick, but like I just would get to the point where I didn't feel well, throat would hurt a little bit, and I think that there's a possibility of not just getting enough sleep, but my sleep schedule kind of being off because I would sleep in the nighttime on the weekend, and then I would sleep in the evening time on those days I was working. So it's a good idea to try to, if you're sleeping evenings all the time, just keep it at that, rather than having these long periods where you don't sleep at all, followed by sleeping at a different time. You want to eliminate noise and light from your sleep environment. So like I said before, with the eye mask, I didn't mention earplugs, so earplugs is a good one too, so you're blocking out the sound. And then light blocking curtains. So some nice thick curtains to block out the sun from coming in. Avoid any caffeinated beverages or any heavy meals close to the bedtime. And then avoid that alcohol before bedtime so we get a better quality sleep. Power breaks. Naps can be used prophylactically to maintain performance during a subsequent period of prolonged wakefulness or before the beginning of a night shift. Naps also can be used strategically to arrest the performance decline that occurs from sleep loss. The basic principle behind napping is that it reduces the homeostatic sleep drive. An on-set site quiet room could be available in your squadron. Consider a power break opportunities after long work shift when the drive home might be hazardous. Exactly. You don't want to be driving home under conditions where you're really sleepy. Maybe if you got an hour of sleep from a power nap, that would be what you need so that you're not so sleepy driving home. Something we have to consider too with our naps is, so maybe you didn't get enough sleep the night before, so you take a power nap so that you're feeling better and then you're getting the adequate amount. So maybe you got 6 hours when your body really needed 7 or more, and you had an hour or 2 of a power nap throughout the day, and then you're making up for that. Something that we do want to consider though is what time you're taking your power nap. So maybe if you're taking at about 4 or 5 o'clock, 6 o'clock in the evening, and you have plans on getting to sleep at say 8 or 9, there's a good chance you might have a hard time getting to sleep. So if you're able to do a power nap earlier in the day, that would actually be better. I've actually had some times where I was watching TV and I'm laying on the couch and it's in the evening and I fall asleep for an hour or 2, and then I find I'm having trouble getting to sleep that particular night because I'd taken that nap when I was sleep deprived. And maybe if I could have taken it a little bit earlier, I would have been able to get to sleep easier that night. Recuperative value of sleep, so a daily 30-minute nap. So in this graph right here, it is showing total sleep deprivation over about an 86-hour period. You can see it falls down to like about 32%. While if they had a power nap, they make an improvement of 25% better performance. So even though the performance still isn't very high from the sleep deprivation, just getting that half-hour power nap does make that much of a difference. Some things to remember about fatigue. Your circadian and sleep pressure rhythms affect your performance, and they quickly can be changed to a new schedule. Also remember your wingman, especially with those around you who appear fatigued. So maybe you might need to offer somebody a ride because they're not in the condition to be driving. Or, just take into consideration maybe why they're being grumpy. Repeated exposure to sleep deprivation won't train a person to overcome fatigue. There's no one-size-fits-all schedule that fits everyone. Some are night owls and others are early birds. So some people will go to bed earlier and get up earlier, while others will go to bed later and get up later. And also, like I said before, some people are going to need more sleep than others also, especially if they're very, very physically active. Some fatigue-reducing strategies. You want to avoid intentional sleep restriction. Jet lag and social lag can result in the same degree of fatigue, so keep your schedules consistent. It's a good idea if you're traveling that you maybe pack some melatonin with you, because when you got jet lag, you're going to be really tired, but you still might have trouble, sleeping because of the time zone that you're in. Use good sleep habits to optimize available sleep opportunities. Use power breaks and naps to make up for the shortened consolidated sleep. Use light or melatonin to adjust to new schedules. So 5K light bulbs installed in your home early in the morning, especially if you don't have access to getting enough light. Absorbing that 5K is good. Consuming melatonin is a good way to help you get to sleep. It is a safe, cheap supplement. I'm not saying I recommend that you take it. However, do your own research on it, and if you feel safe in taking it, it's something that you might want to consider just having on hand in case you're going through a rough patch in your sleep or if you're traveling. What I can tell you about melatonin is it does slightly increase growth hormone levels through the pineal gland. But it is also a diuretic. So if you have to get up in the night to use the bathroom quite often, that is preventing you from getting uninterrupted sleep. For that reason, I do not take melatonin on a regular basis. I try to rely more on boosting my melatonin naturally through the food consumption, especially my evening choices that would they have a lot of tryptophan to help build up more melatonin, naturally speaking. And when you're taking something too, your body is more than likely not going to produce as much of it. So I try to avoid taking it on a regular basis. However, there are times where it's just like, okay, I need it. So right now, I'm actually taking melatonin. I've felt like over the last couple weeks that I've been having a lot of trouble getting to sleep at night, and I decided, okay, it's been too long. I don't want to continue not getting enough sleep. I'm going to go ahead and use this for the time being, and then on the weekends, I'm not going to take it, or I'm just going to take half the dosage, because eventually I'm going to try to wean myself back off of it again. I think that when I change my diet up and I start consuming the pumpkin seeds at nighttime with the Greek yogurt, that I will find myself no longer needing to take it. But I'm glad I have it available during those times that I'm not consuming it, just in case I do need it. You want to ensure sufficient daily sleep and have rest breaks, plenty of exercise and physical activity. However, you might want to consider when you're doing that exercise and physical activity. When I worked at a fitness center that was located near my home, I used to ride my bike home late at night, and I think that made me have a little bit of trouble getting to sleep because I got the heart rate raised up and just had a hard time getting to sleep. So I would recommend you to do that physical activity earlier in the day, no more than 2 to 3 hours. I would not do any physical activity within 2 to 3 hours myself of trying to go to sleep. And doing it earlier in the day should kind of wear you down a little bit to make you want to sleep more or get to sleep a little bit earlier. One more thing I do want to mention about melatonin also is there were some studies found that if you consume melatonin prior to strength training workout, that more growth hormone would be produced, and that's definitely a positive thing. However, you would want to make sure that you have someone driving you or that workout's being done at home, because you don't want to get behind the wheel after consuming something like melatonin and then falling to sleep because of that. Some app resources that you might want to consider is Headspace, Sleepbot, Sleep Cycle Alarm, Breathe to Relax, CBT Coach, and Mindfulness Coach. Some basics behind how to improve your sleep behavior. So we want to avoid caffeine 6 to 8 hours before bedtime and avoid nicotine or any type of stimulants. We want to avoid alcohol after dinner. Sleeping aids, we want to try to avoid those. And I'm not talking about melatonin right now. I'm talking about like prescriptions for sleep. Some people, I guess they're definitely going to have to use them. Doctor prescribes it, and if that's the only way they get to sleep, I guess that's what they got to do. But what ends up happening is you have a decreased rapid eye movement or non-rapid eye movement stage 4 sleep. So the brain isn't going to be getting the repair that it needs. So cognitive function isn't going to be so great when using sleeping aids. You want to avoid exercise 2 to 3 hours before bedtime, unwind an hour before bedtime. So maybe doing something like taking a bath. Now, I wouldn't personally do this, but if I had better flexibility, maybe do yoga. I find yoga to be kind of strenuous, getting into some of those positions. However, people that are more flexible, that do not find it to be so strenuous and find it to be more relaxing, maybe doing something like yoga or meditation would be good ways to unwind, or reading a book or having a good conversation with someone, something like that. You want to control your bedroom environment, so the temperature needs to be cooler in the evening and warmer in the morning. So like I said earlier, the recommended temperature for when the sleep time is 65 degrees. Reading or relaxing novel versus work-related type of material. So you don't want to be reading something that's going to stress you out. Watching TV or the tablet, so you want to try to find some programs or apps that would block that blue light. That way you'll have an easier time getting to sleep because of those light waves hinder your ability to get to sleep at night. So some sleep hygiene guidelines. So doing exercise is going to be a great way for you to get better sleep at night. Let's just try to avoid that too late in the evening, because you don't want something that's going to prevent you from getting to sleep. We want to make sure that that your environment is set up correct. So keep it nice and cool. Avoid blue light. Turn off lights. Use curtains if you need to block out any type of light, especially if you're trying to go to bed before the sun goes down. Take a hot bath if you need to. And then we want to think about, what time it is that we're going to sleep. We want to sleep within that correct circadian rhythms when melatonin is at its highest and cortisol is at its lowest. So summary, prevalence and consequences of sleep deficiency, signs of inadequate sleep, sleep depth and performance, strategies for sleep optimization, how much you sleep you need, and resources available. The need to sleep is biological. The way you sleep is learned. So that's very important. And basically that's a breakdown of, how much sleep are you going to need and what are you going to do to make sure that you're getting that amount of sleep. I hope all of this information that I provide to you will be helpful and make a positive impact on your health and performance. Thank you for joining.